Morning, everyone. It's a delight to be back, Tom and Marcia. Thank you both. And I have four of our team here with me, myself, Todd Cato, Mickey Warhol, and Rachel. We're all delighted to be with you guys and happy to answer questions later if you would like. In 2015, in dealing with a very complex disease and ultimately the death of a family member, there's a team of us who decided there had to be a better way to support the patient and their family as they dealt with something really difficult. And we were driven by a single mantra. We actually wanted your employee and their dependent to get the same kind of care that we would give our own family. And we wanted to make healthcare actually feel like a benefit again. Because over the years that I have been in care support and care management, I've watched that erosion of support happen and the trust relationships in healthcare virtually destroyed. I remember as a young man and as a child, I knew who my local pharmacist was. Today, every time I walk in Walgreens, it's a different face that I don't recognize and barely speak to. My daughter's primary care doctor is the local urgent care center because she doesn't have a primary care physician. We also want to be good stewards of the employer's resources as we took care of their families. Over the past 4 years, we've refined a very human-focused and data-driven approach to transforming the individual healthcare experience. And our work every single day is centered around the patient and their family. And I say individual because it's really easy to say the word member when you're a bit removed from the situation. But if it's your spouse or if it's your child, the human need for compassion and trusted support gets really personal really fast. We've designed, tested, and we now deliver our services to well over 100,000 employees plus their family members on a 24-hour-a-day, 7-day-a-week basis. And as we've grown and taken on more types of plans, including reference-based pricing plans, we've added 12 dimensions to our core service that allow us to do something really powerful. We solve the patient's problem. We don't transfer them. We don't give them phone numbers to call. We simply solve the problem. And whether that problem is finding a local doctor, understanding a treatment, helping them navigate and get through a cancer diagnosis and all those treatments, putting together a price with an out-of-network provider, or just giving deep clinical insight to what are the intended and unintended consequences of a drug, we take that work very seriously. Because we have found that most people don't go looking for health care. It seems to come looking for you when you're in crisis. And I suspect if you're really honest with yourself, most of you have felt that sense of helplessness or the emotion of being pulled along with a healthcare system, feeling uninformed, unsupported, not quite knowing who to trust or how long until they give me the damn test results so I know, do I have this or do I not? We've distinguished ourselves in some unique ways, and I've done this by that past 30 years in leading care support companies. First, we're always open and the lights are always on. Healthcare happens at night and weekends too, and I think it's asinine to imagine you could do care support Monday to Friday, 8 to 5. We also communicate with people the way they want to be heard, whether that be by voice, by text, or by video chat. Because many of our millennial customers had much rather, as they do with you if they're your children, text with you than talk to you. Every individual we support has their own personal care manager that they know by name, and that care manager is supported by an interdisciplinary team that are actually in the chairs next to them that can turn around and talk to. And we use technology so that the member never has to repeat their story, and their data is always live in the system. Moreover, is now a deep partnership with Lucent. We receive all the medical transactions, if you're part of Lucent, every single night. And that 2 million lines of code data we get each night reinforms us every morning of who has had a crisis and who we need to reach out to today. It allows us to take immediate action without waiting on a pre-cert carrier to let us know something or waiting on a claim to eventually show up. Most costly diseases are fairly straightforward. They start from something simple and go to complex. but most of the benefit designs I observe limit care support to something called large case management when it seems a hell of a lot too little and much too late. Healthcare cost in its most elementary terms is this idea that I hear from Brett Rowald a lot. It's called rate times volume. Sounds like something a CFO or a former CFO would say. Yesterday, you heard some great speakers talk about rate and the price management. My entire story today is about volume. It has to do with dealing with the right care, the right setting, at the right time, with the right support, insight, and compassion. And in order to do that well, I'm going to give you a front row seat to exactly what we do with a patient who today we're going to call JR. The story is real. It is lifted directly from the care notes of our nurses and physicians. I've changed his name to protect his identity, but I'd like you to meet him. JR is 64. He's about 9 months away from being Medicare eligible. He's had a history of uncomplicated diabetes and high blood pressure, and he's known to have high cholesterol. His employer switched health plans again in January, and as part of his enrollment, he was told about Narus Health. He reached out to us on February the 1st, 30 days after his plan went live. Now, we had already been monitoring his claims and seeing what was going on, but there was nothing to indicate he was in any level of crisis. On the day he called, as many individuals do, he called us with a question about his health insurance coverage, not with a clinical question, he thought. But underneath his insurance question were many clinical questions we saw. He had just seen his primary care doctor who had ordered some new medications, and he simply wanted to know how much this is going to cost me because I'm in a new plan. And trying to fill these, he wanted to know what the pricing was going to be. His doctor had ordered a very new medication, happened to be one of those that requires what we call step therapy, meaning someone has to try a different drug before you can get that drug, and it happened to be quite expensive. We immediately connected him with who would be his personal care nurse, and on the same day, a number of interactions went down with JR and his physician addressing this particular step therapy because of its cost. We also shared the formulary with the attending physician because he had not seen it, given his plan was only 30 days old. JR was kept informed as our team did this work and trying to figure out what these things would cost and what his options were going to be. The next morning, while waiting to hear back from the physician, we contacted the pharmacy in a proactive way just to ask them to run the medication list the doctor had ordered and let us know were there going to be any challenges with getting those things paid. And sure enough, there were. 3 of the different meds were going to be denied under his new formulary. So we went to work addressing that particular issue as well. We coordinated those calls to get the medications approved, but the new diabetes med was just too expensive for JR to afford. Even with a copay card, we were able to get him. We notified his physician office, and the prescription was changed by the office to a less costly drug. Throughout this process, we talked to JR sometimes 3 and 4 times a day and updated his insurance information with the pharmacy. At the end of day 2, it really seemed that JR would be able to fill his prescriptions without any further issue. We asked him to call us if he had any problems, and guess what? He did. 3 days later, JR called his nurse care manager. The physician, in reviewing his record, had decided he actually didn't want to change the med, and the new order had never been called into the pharmacy. Now we're having a lapse in a diabetic drug, which is not a good thing to do. But the physician was concerned about JR's kidney functions and asked that we get the patient back to his office to go through his lab tests with him. So we immediately called JR, we worked on a schedule, set up the appointment, and got all that done for him. Day 6, JR's nurse called the following day to learn that he had been given some samples from his doctor of the drug, the step drug the doctor wanted him to try. But those samples were going to last him a few days. And he said, I can't afford this. I'll just do without. Not a good answer from a patient. Throughout the day, we coordinated with his physician to help resolve this issue. The physician shared some concerns about JR's worsening kidney function. The physician was actually grateful that our medical director reached out to him in the way that we did, trying to do everything we could to provide JR an option that he could afford that would take care of his situation. The doctor offered 2 alternative medicines, wanted JR to come back and talk to him because he was equally concerned. Both of those medications were about as expensive as the step therapy. They were more than JR's mortgage, and he couldn't afford to take them. We kept this gentleman informed of what was going on with and his physician, and as you can imagine, his frustration. We knew he had hit a low point when he said, "I think I'll just wait for Medicare to kick in." For those of you that know anything about diabetes, that would likely have been a death sentence for JR. So we validated his worries and concern. We took the opportunity to educate him more about his disease and what Medicare would and would not do in the future, and how important this was to he and his spouse and his children, that we worked through this together. And we got him back in a good mental place to deal with this. Having built trust already, JR started to talk a lot to us about underlying financial issues. He knew he had some funds in an HSA, but had embarrassed to tell us because he didn't know if there was anything there that would cover. We immediately went to work on his behalf to know exactly what was in his HSA to see if we could get some medications covered. And all that happened in a single day. Day 7, we followed up with JR and confirmed his physician visit for the week. The nurse took the opportunity to suggest to him some things he could do to help manage his diabetes. Notice we didn't start with that. We started where his crisis actually was, where he wanted help. But now, more informed about his disease and his risk, he agreed to try. We engaged his spouse. And suddenly we had a team of people on the other side working with us and helping take care of this man's health. On day 11, in following up with JR, we discovered that the physician visit didn't happen. Unfortunately, his physician had some emergency that took him out of the office, but the doctor called saying he wanted him to get an updated A1C test. JR had no idea exactly what that meant. Did it need a pre-cert, and how much was that going to cost him? We made sure he knew exactly what a cost would be, that it was not a pre-cert item. We supported his physician office getting the additional updates that they needed on his insurance card. And after a conversation with his physician and our support for his HSA, he was actually able to get his medications filled using some funds from the HSA. We also talked to the pharmacy. They agreed to cut the cost of the drug for JR in particular. Roll 30 days forward. We scheduled a 30-day follow-up with JR because things seemed to be in a good place. On that call, JR reported some additional weight loss, a decrease in his A1C levels because he now knew what that meant. But his physician wanted him to see a nephrologist, which terrified him. He asked for our help in setting up the appointment and wanted to know what all that meant. But this time we had built a solid relationship with this patient and his family. He was looking for us to be his care partner and his single source of truth. We set the appointment up with his nephrologist, facilitated getting the information to the nephrologist that he needed, because there's a lot of history here that we knew if the nephrologist had would probably make a better diagnosis and a better decision for JR. We called JR, let him know his appointment time, made sure he had transportation, that his wife knew exactly the questions she needed to ask, and we asked him to follow up with us after he saw his nephrologist. The day following his nephrologist visit, JR called. The nephrologist had changed some of his meds. That alarmed him a bit because he had originally trusted his primary care physician so much, and suddenly this new specialty doctor had taken half of them away. We talked him through what changes meant like that when you go from primary to specialty, likely how his disease had progressed, and now he was dealing with a super specialist who really understood his kidney functions. We also informed the primary care doctor and 2 other physicians who were seeing JR of his full updated medication list, so everybody would be informed of what JR was taking now. And we updated his records in our system since we knew it'd be a few days before we get the update from the PBM. The nephrologist wanted kidney imaging as part of the follow-up. We helped facilitate that, expedited a pre-cert same day, got everything queued up so he could have the study. We confirmed all of his costs by validating the codes on the workup for JR so he and his wife would know exactly what things were going to cost. And we also relayed the importance of the workup to JR because we knew he had a history of questionable compliance. You can imagine at this point, we all know a diagnosis is likely to come. A diagnosis that for many would have been another 3 or 4 weeks before he had someone helping them do. Day 54, the testing confirmed what we knew was happening, a newly diagnosed kidney disease, which qualified JR for our full complex care program. We'd already won his trust. He was following a diet and a medication plan. We'd also won the support of his spouse and children by now, which meant we had an entire team around him helping him stay compliant with his medications and looking out for his health. We continue even today to support JR on his journey. He's doing well and is stable with no further deterioration, but we all know that we have to have the watchful eye on him because these kinds of conditions can become catastrophic very quickly. In sharing with you this case, there's a few things that I think are important to underscore to you. First is JR started through our population support program, which provide an employee and their dependents 24 access to ask any question they have, and you'd be shocked at some of the questions we get. But it's the very first time many of these people have reached out to anyone other than their doctor for the opportunity to create a trust relationship, and we take it very seriously. His initial pain point was uncertainty of his insurance coverage and what things were cost. He honestly had nothing in mind about his clinical condition when he called us. But because we had clinical experts addressing his issue, real nurses and real physicians, we understood the clinical implications underneath his insurance request, and we quickly earned his trust by sharing with him insights of what all this meant. As JR witnessed the speed at which we broke down barriers, expedited testing, got him appointments, and answered questions thoroughly, even evaluating and giving him feedback on what his HSA would and would not do. He continued to share more and more deeply personal information about his own medical story, and we became close friends with his spouse and his children. He was deeply connected to his care team. This rapport that we created, this trust relationship, led to an understanding of his financial challenges, his risk of noncompliance, his willingness for behavior change, and his proactiveness in addressing his healthcare trend. These issues, folks, is called social determinants of health. And I don't know if you've studied or read anything about them, but this was the area of focus of my doctoral research. In addition to any clinical factor a human faces, the social factors, the level of support they have with a family, to understanding their treatment plan, having their symptoms managed, those social factors complicate every medical condition and can drive up the cost 40 to 80%. Two patients with the exact same diagnoses, one with great social factors being managed and the other without, will cost wildly different sums. And it's important that we collectively understand that and are doing the things to manage those issues. So what made this actually possible in this case? I think the number one thing as I reflect on this case and the work the team did with JR, first is our belief in solving the problem of the person. We never transferred him to another party. We never told him that was not our area of concern to deal with. We never asked him to call someone else. Every time he had an issue, we asked for an hour or so to work on it, and we would call him back, which we promptly did, and our job was to solve his problem. Number two, he never had to retell his story because the entire team, from population support through large case management and even working with the pharmacy on pricing, are all right in the same space, working together in the leadership of a physician. And our job is to coordinate in such a way that the patient never has to feel like they're talking to a new face every day. Number three is we saved he and his family significant time, and we saved his entire care trajectory significant time. keeping his health status in control and getting the meds to help manage his situation in a way he could afford it. JR is like a whole lot of people you know. He's probably like someone in your immediate family. They're faced with the challenges of engaging directly in a healthcare system. Support from a trusted clinical team makes all the difference in the world. For many employer plans, the types of issues we were dealing with were able to address JR and could be handled. But for many plans, that would have been 4 or 5 different parties. That's really hard to build trust. And JR's clinical and cost trend would have been much more catastrophic had we not started when we did. I think the final validation of this relationship that we forged with this patient, just as we have so far this year with almost 4,000 patients, is this. JR shared a childhood photo and a thank you note with his Narus nurse. A stark reminder to all of us that behind every member ID and behind every medical record number is a real person, someone's parent or someone's child, a human looking for help. Had JR's employer only offered clinical support through a traditional large case management program or a pre-cert, it would have been sometime after day 54 before anyone had interacted with JR other than his primary physician, if at all, and he would likely have been completely non-compliant with his medications. We believe great clinical management and really understanding the social issues that drive people's decisions and tailoring a plan to them around their reality of their income and where they live, their access to care, is the only way to create a way that's a win-win for the patient and for you. It saves money. It saves time. It's simply the right thing to do. And it's something you would want for any member of your family. And our belief is we can give that to all of your people. Thank you.